What common mistakes should you avoid when presenting patient cases? Imagine you're in front of your clinical team, about to present a patient case, and suddenly your mind goes blank or your presentation gets confusing. That's why knowing what mistakes to avoid can make a big difference. When you're presenting patient cases during medical school rotations, it's easy to fall into some common traps that can make your presentation less clear or even confusing. Let's go through some of these pitfalls so you can avoid them and shine during your clinical rotations. First, avoid including irrelevant details. For example, mentioning a past surgery that has no bearing on the current problem can distract your audience. Focus on the key points like current complaints, relevant medical history, and findings that directly relate to the case. Too much unnecessary information can make your presentation feel cluttered and hard to follow. Next, organize your history of present illness in a logical, chronological order. Start with the main problem and describe how it developed over time. Cover one symptom at a time and avoid jumping back and forth between unrelated issues. This helps your listeners understand the progression and significance of each symptom. A common mistake is disorganized presentation structure. Always follow a clear order. Introduce the patient with basic details, then the chief complaint, followed by the history of present illness, past medical history, medications, physical exam findings, lab results, assessment, and plan. Skipping or jumbling these sections can confuse your audience and weaken your clinical reasoning. Don't interpret labs or imaging results before presenting the data. First, show the results objectively, then explain what they mean in your assessment. Jumping to conclusions too early can make it seem like you're biased or not considering all the data carefully. Another mistake is omitting baseline data. For example, if a patient's kidney function is important, mention their usual creatinine level. This helps determine if current findings are new or part of a chronic condition. Including relevant baseline information makes your assessment more accurate. Your assessment and plan should go beyond just listing problems. Explain how the findings relate to each other and why certain treatments or tests are necessary. A weak assessment might just be a list of diagnoses, but a strong one connects the dots and shows your clinical reasoning. Be thorough with medication and social history. Mention current medications with doses and how often they are taken. Include social factors like smoking, alcohol use, or occupational exposures that could impact the case. Vague or incomplete histories reduce the depth of your presentation. Finally, practice makes perfect. Present your case aloud multiple times, ideally in front of peers or mentors, and ask for feedback. Recording yourself can help you spot areas to improve, like clarity or timing. The more you practice, the more confident and clear your presentations will become. In your medical school rotations, always ask your preceptor what details are most important for each case. Use a consistent format, like the subjective, objective, assessment, and plan structure, to keep your presentation organized. Focus on your clinical reasoning, explaining why findings matter and how they guide your management. Keep your presentation concise but comprehensive enough to cover all critical points, adjusting the level of detail depending on the rotation. Avoiding these common mistakes will help you communicate more effectively and demonstrate your growing clinical skills.